everyone, this is Dr. Kazi, and in this video we are going to learn about the bones present in your wrist, hands and the finger. That is the carpal bones which are present in your wrist, the metacarpal bones in your palm, and finally the phalanges, the fingers. Now let's discuss that one by one. The carpal bones are total 8 in number. These are arranged into two rows, the proximal row and the distal row. The proximal row consists of the scaphoid bone, the lunate, the triquetrum, and finally the pisiform bone, which is present on the surface of this last bone, triquetrum. Now, the scaphoid bone is the largest bone of this proximal region, and it forms the floor of anatomical snuff box. Now, what is anatomical snuff box? Have a look at this diagram. The anatomical snuff box is a depression which is present close to the base of your thumb, and this depression is used to snuff tobacco or some kind of drug. Obviously, in the old age people used to put some drug on this depression and use it to inhale or snuff. Now, the lunate bone get its name because it is lunar or half moon like, so it get its name, the lunate bone. Triquetrum is the pyramidal shaped bone, and on the surface of this triquetrum we have this little circular bone, roughly spherical bone, which is the pisiform bone, and it is the attachment site of flexor carpi ulnaris tendon. Now let's talk about the bones present in the distal row of the carpal bones, starting with the trapezium, trapezoid, capitate and the hamate bone. The capitate is the largest bone of the distal region, but the largest bone of the proximal region is scaphoid. Do remember that. Now let's talk about the metacarpal bones which are present in your palm. There are total 5 metacarpal bones, and their anatomy is very simple to understand. Have a look. It consists of the head, the body and the base. The base is toward the carpal bones and the head is toward the phalanges, which will form the fingers. Now, the phalanges consist of 14 bones. The thumb only has 2 phalanx, but the other phalanx have 3 phalanx. The proximal, middle and the distal phalanx. Their anatomy is very similar to the metacarpal bones, consist of the head, the body and the base. Now let's talk about some clinicals of the metacarpal bones. Imagine your girlfriend left you and you're very angry. You punch on the wall. Obviously not a good way to release your anger, but anyway, the bone is fractured at the neck of 4th and 5th metacarpal. Have a look at this diagram. The bone is broken down at the neck of this 5th metacarpal bones, this region. Now the finger, 4th and the 5th finger, get shortened because the bone is broken at the neck. Have a look at this diagram from another angle. Here is the fracture at the neck of 5th metacarpal bone. Now this condition is very common in the boxers. That is why it is known as the boxer's fracture. Now, how the force is transferred when you punch on the wall. Have a look at this diagram. First of all, the force is received by the metacarpal bones, then it is transferred to this capitate bone of the carpal region, and then finally to the lunate bone of the proximal row, and finally into the radius bone. This was all about the carpal bones along with the anatomy and the clinicals. In the next video we are going to learn about the trick to learn the muscles of your upper limb. Please do like, share and subscribe, and I will see you in the next video.